It's just perfectly plain. Our circumstances are so unique that without the Addison Gilbert Hospital, people are going to die. They're going to die before they get treatment.
Well, if you were injured, say seriously, and you're running down and you expect you're going to go to the Addison Gilbert, and the ambulance takes you by the Addison Gilbert over the bridge and down 128 and you get to Beverly and you die. Beverly Hospital isn't going to show a death in their hospital. You didn't even get there. But if they had stopped at Addison Gilbert, they could have saved you. And that's the thing I worry about. They just don't care. Anybody must be an idiot if they don't know what they have in plan. And they're going to shut down Addison Gilbert unless the people get behind us. And if they don't, they won't have a local hospital. It's as simple as that.
That many people take it for granted.
And, you know, we'd be lost, I think, if we lost Addison Gilbert. I think most of the community would be.
15 minutes is too long a time period to go without the help that someone could need and save their lives, whether it be allergic reaction or in the case of a young man whose leg was, femoral artery was severed a few years ago by a boat propeller, wasn't able to be flown out and wasn't even able to be transported off of Cape Ann due to the severity of his bleeding. He really almost bled to death. He wouldn't be alive today if it wasn't for Addison Gilbert Hospital and that operating room being open.
I was on a committee that was an advisor to the Attorney General's office on small community hospitals. And I was told by some of the assistant attorney generals, whatever you do, don't allow your hospital to just have an emergency room because it will then be shut down.
To continue to decrease services says to the community, well, what does that say to the community? We don't care about you. You're not people. You're not patients. That's not why I went into nursing.
We have started to see increasingly the services offered reduced, and that has sort of taken a toll on things. A lot of the things that we used to treat and a lot of things that we still could treat are no longer treated there.
With patients coming from the feeder areas in Rockport, Gloucester, Ipswich, Danvers, they would all be considered feeder areas. And hence, as Addison Gilbert was acquired, Cabot was acquired, Hale, Hunt were acquired, the facilities themselves were treated as real estate projects, and the patient base was treated as a patient base mostly for Beverly Hospital, with some distributed services out to the remaining real estate interests.
We are particularly vulnerable because we're the oldest fishing port in the Western Hemisphere here. And fishing is a dangerous, dangerous, dangerous proposition. There's always some problem going on with it. And to have a hospital here has, God knows how many lives it saved.
My life was saved there.
In Rockport, a quarter of the population are senior citizens, and for them to get over the bridge, because many of them don't drive any longer, it's another world there, and they are so devastated by seeing their loved ones out of touch with them, or being fearful that they, as the patients, will be left in a strange surrounding.
And Al has a cardiac issue, so it's important for us to have a place that we can go to fairly quickly.
Here, we hear those sirens from Rockport and the other place in the summer weekends. It seems like every 15 minutes the sirens are going by and going to the hospital. Someone else needs hospital care.
I wouldn't be here if it wasn't for Addison Gilbert Hospital and all the doctors, the nurses, the techs, the departments. I'm a living example, thank goodness, of why the hospital is so critical to the people here on Cape Ann.
I could give you a million examples of newborn infants that have come in with irregular heart rates that we've had to triage and stabilize them, people that are having in the midst of a heart attack. We have a cardiologist that's on call 24/7, Dr. Arsenian. Also, this community has a huge elderly population, people that don't have families around them even, and that don't drive, and there aren't enough ambulances in this area that could transport all those people off the island.
If you think of Gloucester and Rockport again as it's an island, it means more to them probably than it does to other people, because it's just two thin bridges that separate them from being cut off. Any given Sunday or any given Saturday in the summer from June on till September, those communities double in size. It makes it very unique because these are shore communities.
We're a seaport and a tourist destination, and the water provides hazards unto itself as well as the fishing industry. To be able to stabilize people if they've had suffered from trauma, I think is an essential point of view. Someone who's having a heart attack, someone who's having a stroke, someone who has become an infection that's gone systemic, and there could be a life-threatening situation. All of these things require very, very intensive, prompt, competent care. So a full-fledged emergency room, absolutely. A full-fledged intensive care unit absolutely is another essential ingredient. Inpatient care is an ingredient. If a patient comes into the emergency room and requires urgent surgery, and to transport that patient, if that would be a detriment to that patient's well-being, then I think that this hospital also needs to have the capacity, at the very least, to provide emergency surgery. To have to spend extra time to transport a patient in an unstable condition in certain circumstances could be potentially life-threatening.
I was looking up the population numbers, and actually between Rockport, Gloucester, and Essex, we have maybe 5,000 less population than Beverly does. Mm-hmm. So we have the people for our hospital. And plus, we have a lot of older public here. There's a lot of people over 65. They're the frequent users of the hospital setting, and you get all us baby boomers. You know, we're going to be needing it down the road too. I mean, we have a lot of patients coming in that are in their 50s now with multiple illnesses, multiple issues, and it's a needed institution.
First and foremost, you need an emergency room. You need to have an emergency room that's available, because that is where most of the unexpected medical care gets done. And there are certain requirements that you need to have backup for emergency room. Emergency room can't be just a Hollywood set with, emergency room and nothing behind it. You need to have laboratory, you need to have x-ray, you need to have an intensive care unit, and you need to have surgical services.
I've seen other hospitals close in the greater Boston area, and it could happen here. It would be after the fact if it happened, and then everybody would be up in arms.
I do think everybody pulling together can make a difference. We can still see to it that we have the 8 essential services we need to keep our hospital.
It seems today that the way that the public has to influence institutions that are no longer solely based in the community, but that are more business oriented, is to hit them in the business breadbasket. We are a third of Northeast Health System's business. But that hospital can't exist without our business. But I think if Beverly remains unresponsive to the community and the community needs, or actually threatens to shut the hospital down, I think that's what should be done.
If I have to have any kind of procedure done, I still ask that doctor first if he goes to Addison Gilbert, and if he doesn't, I switch doctors.
And, you know, you got to go right to the larger entity as soon as Gloucester has to be pretty well organized, and Rockport and Manchester and Essex, the people that use it, and go to them as soon as it happens and say, this is what our priority is.
As long as folks on Cape Ann stand up and demand to have their hospital facility be supported, then I think the administrative powers that be will listen to that.
I think with regards to the Northeast Healthcare Administration, if they wanted the Addison Gilbert to succeed, it would very easily.